Welcome back to Let's Talk Value podcast series in 2024. Can't believe we're already close to 50 episodes. So it's my distinct pleasure today to welcome Dr. Rob Matheis. Hi, Rob.
Hi there. Good to be here, and thank you for having me.
My name is Verena Wolter. I'm the CEO and founder of a small consulting firm called 5P Healthcare Solutions and the author of the parent book, I should say, It Takes Five to Tango. And I'm really excited to talk with Rob today because I know many of those 5Ps are very close to your heart. Mainly, I think we'll talk a lot about patient focus, but also obviously the parent provider. I always say, no doctor-patient relationship, no healthcare. So the doctors are important, but maybe a little less in the focus today. We both have spent many years in the pharmaceutical industry in medical roles and communication roles. But obviously, there's also the payer and the policymaker, which are kind of making the circle complete. So Rob really comes with a distinct set of expertise as a clinical psychologist, I believe, in the background still today.
Correct, yes.
And you've done many different roles in healthcare to move the needle towards patient-centric care and innovative drug development and communication and engagement. But today, Rob is, maybe I should say again, with IMSPP, so the International Medical Society for Publication Professionals. He serves as the CEO now and president. So very eager to hear from you, Rob. You know that I always start off with the question on what does value mean for you in healthcare, but I also want to make sure today we talk a lot about, because communication is really your core skill set and expertise, and how does this relate to value creation through patient-centered communication. So we'll talk a little bit around many of these things. So enough of me talking, and let's kick us off. What comes to mind from a 50,000 bird view on value in medicine and healthcare, Rob?
Yeah, it's certainly a very large question, and it's one that we could probably spend a couple hours trying to tackle for sure. But when we think about value, I think we're thinking about a very broad approach to thinking about what is actually going to move the needle, as you've mentioned, in the healthcare ecosystem. And value, in my mind, comes about from bringing those stakeholders together and really getting them thinking upfront and early about what the outcomes we're trying to achieve are. So, and value can be defined in a lot of different ways by different people, but agreeing on what those outcomes are at the outset brings all the stakeholders together from the very beginning. So, for example, I represent the area of publications and medical communications professionals. We would traditionally have a very isolated view, right? What's the job of a publication professional? It's essentially to get publications put into peer-reviewed journals, correct? And maybe a couple of years ago, I would have said that was the endpoint, but today we're not able to think in such an insular format anymore. Today, publication professionals, medical communication professionals have to really think way down the road, and they have to ask themselves the question, if I'm really going to achieve value, if I'm really going to move the needle and help patients at the end of the day, then what needs to happen with this publication when it's done? Gone are the days when a physician is probably sitting there, or a healthcare practitioner sitting at their armchair after a long day of work and reading New England Journal of Medicine. If that was ever the case, it's certainly not now. Today, they're actually getting most of their content and information from other sources. And so, being a part of the value chain really means thinking about all of these different aspects, defining what the outcome is and how to get there. So Rob, I could go on for hours. Go ahead. Yeah.
No, I think you hit it right out of the gate here. The key points, bringing stakeholders together is creating value. This is like music to our ears, I think, to many of our listeners. I have to say, in the close to 50 episode, we have not heard that definition yet. So it's fantastic to kick off the year with this, that it's about a broad set of stakeholders. And I also like you put forward, like, we need to focus on the outcomes. What is it actually we want to deliver? But I really am curious, one question listening to you, as you said, traditionally, it was more of an isolated view and job. So what brought you to believe now that this is old days, and that definition of value of working together, what did bring you to think that today?
Well, it's a couple things. Number one, I guess, to be honest with you, I started to get a bit jaded thinking about our traditional metrics, right? So when I looked at my own profession of publications, and I thought, well, gosh, we're being measured by just how many things we plaster on the wall at ASCO or, whatever it may be, quantity, right? So, and I thought to myself, well, is that really actually moving the needle? Is there a patient somewhere at point of care, for example, or a payer, in a formulary decision process or health technology assessment? Are these things actually being impacted by the 200 abstracts that were submitted to XYZ Congress? And when I didn't believe that was the case anymore, I started to think, well, maybe this is not the way it needs to be. And then a corollary to that is, well, if we really do want to move the needle at the end of the day, you can't do it on your own. So a publication, and I come back to publications because that's the area I'm swimming in these days, but a publication professional can't move the needle without knowing what's happening with other stakeholders. So it's impossible to know impact unless we know what's happening in the field, maybe field medical teams, or what's happening in other areas of the ecosystem. So that's where I started to think of this much more holistic view of getting stakeholders together and really trying to think upfront about what we're trying to accomplish.
This is amazing. How are you doing, or how would you recommend we do this practically? Because you said, get different stakeholders involved in discussing early on, or maybe you have an example on, you just mentioned also medical field. So how would we operationalize that?
Well, that's the $1 million question, right? So if I could answer that,
Maybe you have like from your own ways of working, like how do you encourage your teams on doing exactly that? Listen, getting insights on what actually matters and where's the impact. How would you advise somebody to put together teams or workflows?
Yeah, it's a great question. I really think at the heart of it is a lot of awareness building, right? So, typical teams when they're put together are not really necessarily instructed or motivated to think outside their own teams. They're thinking about their own objectives, their own goals. So have an awareness building objective of thinking about what those common goals are at the forefront. The other area that I think is important in trying to do this and operationalize it is having champions. So, having someone who's empowered to do it, sees the big picture, and then can carry that ball across the goals that you're trying to accomplish. I know it's easier said than done, but definitely raising that awareness, making sure there's a champion and someone who's going to feel responsible and accountable is really critically important.
Yeah, and I think I love what you say, like putting those multidisciplinary teams together. So not only within their silo, so bring in other people. And I remember in one of my former jobs, we had the MSL, the medical director, even a commercial representative, a regulatory person, depending on what product we're talking about. And then obviously SciComm people, MedInfo people, safety people, think out of the box, but like have other people there. And I like this common objective for the team. I think it's very powerful.
It's very, very powerful. The other thing that just came to mind when you were chatting is I think it also helps when we're talking about functions to keep it simple, right, for us, but when functions are able to actually quote unquote cross-train and see what other functions are doing. So, I can remember my job was deeply impacted when I was just a beginning publication professional, and my only job was to keep my nose down and make sure that I got publications into the journals and into congresses and count them up. But my job was enriched when I was able to get out into the field a number of times, and I was able to watch a formulary discussion. I was able to go on a field medical visit. I was able to see what other functions were doing, or visit with the medical information folks. And then I was able to see, well, okay, but this publication doesn't stop here. It's got to go beyond that. And you can generalize that type of quote unquote cross-training to all the disciplines, all the stakeholders, that they'll do better at what they're currently doing if they know how other people are going to be impacted downstream.
Mm-hmm. And this is another piece in the vocabulary, is actually the vocabulary. So understanding other functions lingo, because we all have our own kind of culture and acronyms and the way we think and speak. So these cross trainings, I like the idea, are not the purpose to learn the other job, but to understand what their problems are. And I think some organizations do this really well, right? They have secondments, they do, whatever, 4 weeks immersion. I mean, there's no barrier on creativity here.
Correct. Yeah, the more creative, the better. And I think the more exposure makes you a well-rounded person, but it also professional, but it also really helps you to be much more effective at what you're doing if you know what's going to happen with the things that you're producing in your own shop. Mm-hmm. That's great.
Maybe we move again towards what you said, we need to think about what's really the impact down the road, in your case, the patient part, and what matters to patients. And I know that patient centricity in patient care is very close to your personal heart, but also what you do in your current function and with the teams. And there's a couple of your own podcast series that put that in the center. So in terms of communicate, almost patient-centric communication, what is that actually? How can we think about that? How do you make that happen?
Yeah, it's another way, and that's a great question too. We need a couple hours for sure, but it's another way of redefining what our goals are, right? And so, at the end of the day, our goals are not just to move the needle on what it is that we're doing from a functional point of view, but it's actually to impact patient care in a positive way. So whether that's a decision being made at point of care around one product, service, or technology that's being considered, whether that's a broad formulary decision or whatever it may be, the patient perspective on that, as we've learned, is maybe very different than what our perspective is. So as we're thinking about and contemplating our efficacy endpoints and are confident that that's going to move the needle, that may not actually be related to what's important to the patient. And those other, patient-reported outcomes, that we can get into all that type of thing. So, having much more of a patient focus allows us to be informed on the research side of it, so that we're designing trials and studies that are closer aligned to what the patients are actually needing. But it also informs us on the communication side. Our area in the MedCom space, we focus a lot on the plain language summaries, those translations of the research so that it can be understood. And what's funny about that is when we chat with people, we find those plain language summaries, it's not just for the patients. Yes. The physicians want them too.
It's for us ourselves, right?
Right. Things have gotten so complicated that everybody needs it. And, not to take us on a whole tangent, but that gets us into the bucket of evidence translation. So at the end of the day, all these things need to be translated in a way that it makes sense for the patient, makes sense for the practitioner, and all the P's involved in this. So.
No, that's great. Maybe also because we're talking, yes, drug development, innovation, but also general care delivery and outcomes and how we improve those. And I think part of this is real world evidence. And, how do we complement the more regulatory, pharmaceutical, academic drug development and clinical research part with what's happening actually in real life? I know this is also an area that you work on quite a bit. Any thought here?
It's another soapbox for me, right? So we can start to talk about efficacy and effectiveness and so on, and the differences between, internal, external validity and HEOR. At the end of the day, the philosophy I have is that all the data types that are available to us are needed. And when I first came into the field, I can remember, when we thought about health economics, outcomes research, or real world evidence, it was a kind of an afterthought, right? So as a publication professional, I would be so proud. I'd have my study plan done
somewhere, right?
Yes, we kept them in the basement somewhere. We had our RCT plan, and we're so proud. But and then I would run down the hall and I'd look for the HEOR people and say, are you sending anything to ISPOR? And and that's not really the best way to integrate a real world evidence plan that's going to move the needle. So incorporating, whether it's the PRO, patient-reported outcome endpoints, or actual real world evidence for what's actually happening in the real world, looking at those effectiveness studies, that should be part of a comprehensive plan. That should be part of what we're thinking about when we're putting our evidence generation plan together. And that involves all stakeholders. So the soapbox message for us is that this really needs to be done not in a vacuum. And that, again, bringing all the stakeholders together to think about the full value story is critical. And that involves real world evidence.
And going back to our virtual cross-functional team earlier, HEOR, or real world evidence, or however the acronym of that team is in an organization, should be part of that team.
Absolutely.
Right? You said,
absolutely.
Put together comprehensive plans early on and not be an afterthought, and bring them up from the basement into
yeah
the other people sit.
The other thing is it gets into being more deliberate and more strategic, I guess is the right word for why we're bringing certain evidence types together. So certain studies may not make sense to do, and then other ones might be necessary. But if we're not having those discussions up front, tying this whole thing together, and it's nice how nicely it weaves. If we're really thinking about our outcomes and we've got all the stakeholders together, it should be a comprehensive discussion, a disciplined, decisive conversation around what needs to be happening, so that left to our own devices, people just produce things. They do studies that maybe don't have meaning or impact, or they write publications that don't have meaning or impact. But if we're being very deliberate about it, we can streamline and be much more efficient to get to those outcomes that are necessary.
Mm-hmm. Just having another thought as you're talking about the lingo evidence generation, and we had in the old 1.0 medical affairs days or pharmaceutical days in general, we were talking about data generation and data dissemination, which is kind of dissemination is also part of the communication part in SciComm and MedCom, and and that is a little bit of an artificial interface, right? Because what we're saying here is, why so sequential, right? Why data generation over here and data dissemination over here in another silo?
Yeah.
Any thoughts around evidence generation and communication?
For sure. Yeah.
Does
I would like to see, if I
evolve?
had a slide, I'd want to see what the starting point of that looks like, right? Because you could say that's the data generation, but the way I think about it is, in a lot of ways, the beginning of that cycle is the communication plan and the gaps in that plan that inform what the data generation cycle should be. So, it's kind of neat to start to loop that out, and it's neither one is actually the starting point, right? It's kind of an ongoing cycle of producing data that's needed, communicating it, seeing what those gaps are, translating that evidence for utilization across different stakeholders, different channels, and then seeing what the gaps are. So when you start to make it complex like that, the gaps are not even just data gaps that are there, but it may be channel gaps. How we're getting that evidence to people. Maybe we're missing a communication channel that we haven't accessed, and that's one that's being needed by a certain stakeholder.
And that brings back kind of to the initial statement you made about value bringing stakeholders together, right? It's like thinking holistically rather than sequentially.
Absolutely. It's interesting when you think about how strategic plans, medical affairs strategic plans, have evolved over time. They used to be a lot more linear, so it was very simple. And I keep going back to when I first started in early publication roles. There was a couple columns, and you had your list out of the data points, when you expected them, the journal, and that was it. And now you almost have to make that 3D, right? It's a cube where you intersect the channels, and you intersect the timing, and the data type, the real world evidence, where things are going, and the metrics that come out of that. We could spend hours on that, are much more complex and much more informative than they were before.
And I know this is another episode if I open the digital box, but I know that you also work innovatively, because I think it is going, the number of intersections and things in parallel we need to think of is going beyond a little bit our human comprehension and human intelligence. So the listeners see where I'm going to, like, AI supported models and, to help us process and analyze the multifactorial channels.
Yeah, you almost have to tell me not to talk about AI during this episode, because it could really take us in a whole other direction. But I guess in the bigger picture of digital, if we start to think about what that means, for me, it means a couple of things from a communication evidence generation perspective as well. Is that we now have an ability with digital as a whole to do more with the data than we did before. So whether it's data visualizations, whether it's infographics, talking head videos, whatever it may be, that being the case helps us to be better translators of evidence. So going back to the very beginning, when I was discussing this transition from, moving from publications into medical communications in a broader sense, it really means that we have the tools and resources now to be able to take that data and translate it to something else, because we have those digital tools that can make it possible. The art, though, that comes into that is not just doing it all. So the error that I see being made very most often is, we have digital, we have the ability to do things we never did before, and they're cool, they're shiny new toys, and people like them, but it doesn't mean we should be doing all of them. It again goes back to being very disciplined about thinking, this is my target audience, this is what they need, this is the tool, this is the channel that's going to get us there, or the digital resource that'll get us there, and doing that in a very disciplined manner, if that makes sense.
Excellent. As we said in our quick briefing before the recording, time flies with these discussions. So we're already at the almost 20-minute mark. So we were just opening a few soapboxes and doors, and to get everybody, spinning in their wheels, and what can I do in my day job differently to connect those different stakeholders. So there's plenty of things I guess you wanted to speak more of, but is there this one burning thing you want to make sure the audience takes away from your visit today?
Yeah, I think the message that I would have is, to have big picture thinking. And so it's a message that it's kind of been thematic throughout this entire discussion, which is to take that step back and to be disciplined about what we're actually trying to accomplish, and to look at the big picture. All too often, because just the way things are organized, whether you're talking about a hospital setting, you're talking about a pharmaceutical organization, whether you're talking about any of these different institutions, our tendency is to be very insular focused. And so where we started this is where I think it's probably a good key message to take away is take that big step back, find out what others are doing, find out what's important, and ask relevant questions. So the work you're doing has more meaning and it can be more efficient and ultimately help the patient and move that needle in that regard.
Thank you very much, Rob Matheis.
Thank you. It's been a pleasure.